Hi, I'm Dr. JP Tupta with South Charleston Chiropractic, and I'm a chiropractor here in South Charleston, West Virginia. Today I want to continue to talk about some frequently asked questions that I get as a chiropractor, and we're going to continue to stick with some of the basics and talk about what is a chiropractic adjustment. So a chiropractic adjustment, otherwise known as spinal manipulation, is a procedure in which a trained chiropractor delivers a quick thrust or force to one or more joints of the spine. And this can be done in a variety of ways. There are many different techniques. Typically this is done by hand. We will position the patient in a certain way and then deliver that quick thrust or that quick force to the spine. Some people aren't comfortable with some of the force that's used during these adjustments. Even though they're relatively gentle, some people still aren't comfortable with that. So we have other options that are very low force and very gentle. One of the most popular ones is a little tool called an activator. It's a little handheld instrument. And what we do, rather than pressing on the spine and the neck or the back, we just place this over the area that we want to move, and we click it a few times. It basically just gives a little punch or a little force to help create some movement in the joints in the spine. So through our physical exam and palpation, we identify areas in the spine that are fixated or stuck. There are multiple joints between each of the vertebrae in your spine, and sometimes they can become fixated, stuck, and can limit your range of motion and ultimately cause muscle spasm and pain. So we not only identify the levels or the areas of the spine that need to move, we identify the way that they need to move. Do they need to rotate left, right? Do they need to flex or extend or bend to the side? And that's how we decide what techniques that we're going to use and the types of adjustments that we're going to perform. So we don't do the same adjustments on everyone. A lot of it looks very similar, but each adjustment is tailored specifically to your needs, and also it's tailored to make sure that you're comfortable. So some people aren't comfortable with certain types of adjustments, and there are always different ways, there are always other options. So be sure to communicate with your chiropractor if you're not comfortable with something. We can always find another way to help you, to adjust you, or we can maybe try something that doesn't include the chiropractic adjustment. So one other question that I get a lot is, what is that cracking or popping sound? Now, the cracking or popping happens quite frequently when we're performing the adjustments in the spine, but it's not necessary for the adjustment to be successful. So it doesn't have to make a cracking or popping noise. A lot of times it's satisfying. We like to hear that sound. But research actually shows that there's not a big difference in spinal manipulation performed with a cracking or popping sound and without a cracking or popping sound. So that's one thing that I want people to know, is that if it doesn't crack, that doesn't mean that it didn't work. But the cracking or popping sound is not the bones breaking, nothing's fracturing. What that noise is actually a gas bubble, a nitrogen bubble forming inside the joint. So for a long time we thought that it was a bubble popping or bursting, and that was the sound, but there have been some studies that have come out recently studying joints being manipulated or moved in real time using MRI, and what they found is that there's actually a small cavity, a small gas bubble that forms in the joint, and that's what makes that popping noise. So when that gas bubble forms suddenly because of a quick movement and the joints move beyond their normal range of motion, that creates a popping noise and a cracking noise. Like I said, it's not the goal of the adjustment to make it crack. It does happen a lot, but that's something that is not necessary for an adjustment to be performed successfully. So I hope this helps answer some questions about what is an adjustment, what's the cracking noise. If you have any other questions, please leave a comment. I'd love to answer some of the questions that you guys have, and I look forward to helping to educate some people about some of the benefits of chiropractic care, helping to clear up some of the misinformation that's out there. So please subscribe to my YouTube channel, like the video, and share it with your friends. Thank you. I'm Dr. JP Tupta with South Charleston Chiropractic.